Welcome back to PsychFM. Today we have Dr. Annabelle and Dr. Adrian Wang with us. Dr. Adrian, would you like to introduce yourself?
Hi, I'm Dr. Adrian Wang. I'm a psychiatrist. I've been in private practice for very long, for 18 years almost. I'm at Gleneagles Medical Center. I see mostly adults and some children.
So, welcome Adrian onto our show, and thank you so much for being part of this gig.
Thank you, Annabelle. Thanks for inviting me. I'm very honored.
Yes, I'm very excited because Adrian and I go some time back.
Yes, we've been friends for years.
Yeah. And it's very exciting, and we're going to put our chemistry to test today.
We'll try. Yeah.
Yep, so I suppose today we'll be talking about BPD.
Yes, a challenging topic.
Yes, something that I'm pretty passionate about, and something that we do work closely with. So I think the first question that we want to kind of put out there would be to clarify what borderline personality is.
Borderline personality disorder, well, to qualify as a disorder, it has to impact the quality of your life. There are people with borderline personality disorder and people with borderline personality traits. You may recognize some of the signs and symptoms we're going to describe. It does not mean you do have borderline personality disorder, but it's good to know that you may have some of these borderline personality traits, and we'd like to talk about how you can manage that, especially in a relationship. But in borderline personality disorder, the key feature is a fear of abandonment. So the person with BPD feels very insecure, and they are constantly in a state of crisis. They worry that people will leave them, they feel that they're unlovable, and sometimes the person then reacts and creates a crisis because of this fear of abandonment, whether it's real or imagined.
Yeah.
It's normal for all of us to want to feel validated, to feel that our emotions are genuine and real. And the roots of BPD, borderline personality disorder, may come from some childhood trauma, but the genesis or the origins, I think it's quite complex. Trauma certainly plays a big role, but nobody really knows what causes BPD. It could be genetic, it could be things happening in your past, but the main problem with BPD is this turbulent state of emotions they go through. They have extreme mood swings. In fact, many patients with borderline personality disorder think that they are bipolar, but they're not. It's actually two separate things. People with bipolar disorder have mood swings. People with BPD also have mood swings. But as you mentioned, there's some features of BPD. There's some black and white thinking. They overgeneralize things. So in helping them, we need to help them develop some sense of insight to understand that why they think this way, and then we need to help them reframe their thinking. That's why we use cognitive behavioral therapy and other methods to help them understand why they think in a certain way and have better ways of coping.
Yeah, thanks for bringing that up actually, Adrian, because I think that's really a very common referral question in clinic. They come and then they ask, oh, do I have borderline or do I have bipolar disorder? Because the symptoms can be quite similar. And I think one of the hallmark features is that with bipolar disorder, the symptoms are not specific to a particular trigger. So they're not triggered by someone leaving, or they're not triggered by a certain interpersonal relationship. But with borderline personality disorder, the intense emotions and the fluctuations of mood tend to be actually triggered by those interpersonal relationships usually.
Yes, that's a good way of describing it. In BPD, the emotional shifts are snappier. It's up and down really quick. In bipolar disorder, which we're not really talking about today, but just to give an idea, in bipolar disorder, there's an ebb and flow to it. It gains momentum. There's a stream of good ideas. There's a feeling of euphoria, and then it cycles downwards. So it's like a car with an automatic transmission. You can feel the gears moving. Whereas in bipolar, it's like a car with a bad automatic transmission. It jumps from fourth gear to first gear, and is much choppier.
Okay, and that's gonna stick with me now. I'm gonna actually use that in session. Yeah, I think that's a really good analogy to kind of think about the distinctions.
Yeah, about the flow, how it flows.
Yeah.
Hey, actually a lot of that sounds very familiar. With a person, you were talking about a person who maybe has some interpersonal challenges in trying to get their needs met. So in that sense, if I knew someone who had BPD, how would I support them? Do you have any tips?
When you have a relationship, whether it's a platonic friendship or a romantic relationship with someone with borderline personality disorder, the term that's often used is that you have to walk around them like you're tiptoeing on eggshells. So this is very tiring. We need to help them understand their feelings. It comes across as manipulative or difficult behavior, but it's often more a cry for help. Don't you agree, Annabelle? It's a cry for help that they are easily triggered, and they fear that the person is leaving them. So they constantly need reassurance. But as a partner or a friend of somebody with BPD, if you keep constantly reassuring them, you're going to feel very tired. So you need to find that balance between being there for them, but also explaining to them that they need to learn how to manage their emotions better. And this is very tiring. It's very challenging for caregivers, for spouses, parents, family members.
Yeah. So I think the first starting line is when you put two people together, there will be challenges.
Absolutely.
Mental health condition or not, like two different environments, two different personalities, there will be challenges. I think when we get a diagnosis, maybe the first thing I would recommend is to equip ourselves to understand what the diagnosis actually is and what it entails, and also definitely get your information from credible sources. So when you understand it a bit more, I think the second step might be to kind of assess and be genuinely honest with yourself as to whether you have capacity to deal with it. I can't remember. Oh, okay. I think there was this movie that I watched with Anne Hathaway. It's not about BPD, but it was something about her having early Parkinson's. I don't know if you know this movie.
No, I don't know.
It was on Netflix recently.
Oh, okay.
She's this lady who was acting with young Parkinson's, like early onset Parkinson's. And one of the things that a caregiver was talking to her boyfriend about really struck me. The caregiver actually said to the boyfriend, like, leave now because it's going to get worse, and you would just have wished that you left 20 years ago. But the boyfriend in the end decided to stay. Because he assessed the situation, he learned all about it, and he decided, I can do this. And so he decided to stay. And that really stuck with me because it doesn't quite matter if it's really a mental health condition or a medical, like a chronic medical health condition. I think the similar conditions apply, right? We want to understand what the condition is, and we want to be genuinely honest with ourselves if we actually have the capacity, the bandwidth, the ability to deal with it. And there's no shame about that. Some of us have bigger bandwidths, wider bandwidths. We have the ability, we have more patience. Some of us are lesser resourced, right? And from there, I think we can kind of make a decision. If we decide that we can't deal with this, then we may actually have to have difficult conversations with our partner, that we divert them, we send them to resources that are helpful and meaningful, and then we have to explain that we can't do this for the long haul. But if we then decide to stay, then we're going to equip ourselves with skills and with abilities to be assertive, boundaries, to be able to look after our own needs and to be able to communicate our own needs, the ability to make space for intense emotions, and then all of that will kick in.
Yeah, that makes that sound advice and good advice, Annabelle. I totally agree. On the subject of movies, some of the older listeners and viewers may remember that the movie with a negative portrayal of borderline personality disorder is the one with Glenn Close in it, Fatal Attraction. Glenn Close and Michael Douglas.
I'm so excited. I'm not old enough.
Really? Not
what are you talking about? This is a movie. Fatal Attraction by Richard Gere? No?
No. It's I gotta Google it, but it's the one where Michael Douglas, when his wife is on vacation, has a one-night stand with a woman, and that woman is played by Glenn Close. And he thinks it's just a one-night stand, a simple transaction, but Instead, this woman then stalks him and stalks his family, and she manipulates the situation by pretending to be a friend of the family and getting close to his wife and children. And because it's a Hollywood movie, of course, a lot of it's just generalization and just a lot of sex and violence. But it's a caricature of borderline personality disorder and what can go wrong in a BPD relationship. But like I said, it portrays BPD in a negative light, and in this movie, Michael Douglas is the victim. He's stalked by this character played by Glenn Close. So, like you said, in managing in a relationship with a person with borderline personality disorder or even borderline traits, you were saying that is developing a sense of understanding and helping that person develop insight, and then directing them towards the right resources. But if you're in a relationship with someone with BPD, well, firstly, it's very tiring, you see. So the important thing is to be consistent. You have to be consistent because the person with BPD will focus on these negative things. And you may still be consistent, 99% of the time you're supportive, you're there for that person. Then you have a bad day and you're grumpy, and that person says, "See lah, you don't love me anymore because you snap at me," and then chooses to focus on that. So being consistent is important, and clarifying all the time. I think the difficult conversation that comes to mind is what happens when the BPD person has a crisis, because a crisis escalates really quickly. It's like a sports car that goes from 0 to 100 in a few seconds, you see.
Oh, Tesla.
A Tesla, right? Yeah. No, I don't want to buy Tesla. But this is the problem, right? So and just as quickly the person can suddenly flip around and says, "Oh, okay, I'm all right," and then that's why people think that, hey, this person is crazy. He or she must be bipolar, but it's actually BPD. So learning to manage crisis, learning to de-escalate. Well, actually, first learning how to not get into a crisis is the key thing. But when you're in a crisis, how to handle it, because another feature of BPD is a tendency to self-harm or talk about suicide and death. And any threat of self-harm or any talk of suicide should be taken seriously, you see. So like I said, in BPD, it's a fear of abandonment, and the person creates a sense of crisis so that they want to be rescued. They want you to show that you care, you see. And managing that is tricky.
It is. I think often, how I sometimes in a separate conversation, I work with mothers, and we always talk about how it takes a village to raise children. I also remind them it takes a village to raise a parent. I also think it takes a village to support actually anybody. That includes a person with borderline personality disorder. I think that it requires the combined effort from family, from friends, the community. Even sometimes I have patients who work with their neighbors or even their partners. And I think that the more supportive and more consistent and more stable the community is for them, it provides them more resources, and no one person feels particularly burnt out that quickly in that sense. So you know how you say, like, try to avoid the crisis, right? Hey, come on, Adrian. Can you avoid a crisis?
No, we can't. So that's the trouble. Yeah. So because life will throw a curveball at you, right?
Yes,
you'll have work stress, exam stress. You'll have a bad day.
Correct. Yeah. So I think it's kind of like managing the intensity. So maybe I wonder if it's like having very honest, open conversation when we are not in crisis mode about how to manage the crisis, and get a bit of like a verbal contract that we're going to try these things, and this is the way I'm going to show you that I care for you. This is the way I show you that I love you. And when I draw a boundary, it doesn't mean that I'm going away and I'm going to leave you, and I'm going to say what I mean, right?
Yeah, I totally agree with that. That's excellent advice, Annabelle. I think that in therapy of BPD, the battles are won not during the war, but during the preparation, right? When you set the groundwork, and I like what you said about how you clarify with the person, you educate them about what are the symptoms and how to deal with it, and when you're triggered, I tell people it's like a fire drill, right? When the building's on fire, you just go through the steps in your head. You don't think, right? Yeah. So when you think a crisis is going to happen, then you just go through the steps. Okay, remember I said this. Remember that this is the foundation of a relationship. This is the reassurance I give you. So I think I totally agree with that advice. Yeah.
Sometimes I have even gone to the extent of getting them to write. Because exactly like you say, right? Like an actual fire happens, we can't think anymore, and we can do what we agreed, right? But it's not going to connect. So sometimes like having a written agreement has been quite helpful for some of my patients, because they have something like kind of real, like something tangible to hold. But I think that's very unique to the person's circumstances. So it's kind of working with them and their partner as to like what would actually be helpful for them. And it's not textbook. It needs to really be specific to this couple.
So I think in people with borderline personality traits or borderline personality disorder, the good news is as you grow older, as you mature, as we should all mature, it gets better. But it may take years, you see. So if you are a partner or if you're a family member of somebody with borderline personality disorder, you have to remind yourself you're in for the long haul. Don't give up. It's as the person grows older, the person gets better. And the treatment is a combination of both therapy, psychotherapy and counseling. Sometimes as a psychiatrist, I might prescribe medication, but I would say that the therapy is the more important component. Okay, and sometimes when working with somebody like Dr. Annabelle, I'll say, we're going to work together as a team, but Annabelle's the main driver. I'm the co-driver. I'm the backseat driver. Okay, so you got a problem, you can find her. So because the therapy is important, and a therapist, a good therapist, a good psychotherapist and counselor like Dr. Annabelle is crucial in helping the person develop insight. Right? And those fire drill skills we talked about. Yeah. The doctor's role is sometimes secondary because we provide medical support, right? And sometimes if the person is having panic attacks, the person has severe depression, yes, medications definitely are warranted. And my role is to explain the pros and cons. I'm definitely not going to prescribe something that's going to numb your emotions or cause you to be addicted to it. But sometimes we'll have to so the medication is a component of an overall holistic picture, but the bigger picture is the therapy. That's why you're the main driver and I'm the co-driver. So it's on you, okay. Annabelle.
Wait, my turn. Okay, you say that. But I think that sometimes medications are really, really important because I have worked with patients where they can get really aggressive. And I think the medications can be really helpful, or they can get really, really anxious, or their mood can be really, really low. And in those circumstances, they wouldn't actually be able to participate in therapy. They may not even be able to turn up for therapy. So without that medication support, we won't actually be able to proceed at all. So I think it's really, and research does show that, right? It's really a combination of both. But more importantly is actually the consistency between the psychiatrist, the psychologist, the patient, and the patient's community. Because sometimes words might get lost, right? In conversation, the communication might break down. We might have misunderstandings of what we mean or what we say. And it's really important that we all stay on the same page and have frequent communications about the person that we're caring for.
Yes, I agree entirely. I think it's important to work as a team so that we're all on the same page. We provide consistent sound advice to the person. So the caregiver needs support as well. I'll say a few more things about medication if I may. Many people are worried that medications are like a crutch, that hey, if I'm strong enough, I don't need medications, right? I should be able to power my way through therapy, my way out of it. I shouldn't rely on a medication. And sometimes this is counterproductive because you're beating yourself up. The science says that there's a biological basis, a chemical, a neurochemical basis to our emotions. So using the medication is not just to numb your emotions, it's not just to reduce the pain. Yes, the medications do that, but the way to think about medications is that the medications are like the training wheels on a bike, all right? I'm a cyclist, so you need to ride a bike, right? So the small wheels hold you up, right? And so you don't fall down, but then you need to build your leg strength and your sense of balance so you can pedal yourself forward. So the medication provides the foundation in your brain, the serotonin, the norepinephrine, the dopamine. You need that foundation. And once you've got that foundation, then when you do the therapy, that reverse engineers itself in, right? When by doing therapy, you build these chemical pathways that the small little wheels set you in motion. So the combination of chemistry with meds and therapy, equally important. So you mustn't sell yourself short and say, hey, if I have to go and find this doctor to take drugs, then I've got problem. No, it doesn't work that way. It's a holistic approach. And you need to use whatever tools that are necessary to help yourself get better.
Yep, absolutely. And I think working with a competent, ethical psychiatrist is really important because I think sometimes it's also about fit, isn't it? I think a lot of my patients share with me that they feel really comfortable working with you, where you actually explain to them the pros and cons of every medication or the dosages, and explain to them like why you put them on certain dosages and why you increase over time. I think that conversation has been particularly helpful for them.
Yeah, I think all doctors should try to do that, and I used to be a government doctor. I used to work in a big public hospital, and as long as you find a pocket of time to explain it the way I did, just to take away their concerns and reassure them so that they feel that you're on their side, then they'll come back and see you.
You brought up a really important point, because underneath that explaining is a connection, right? That you see their concerns with medication, their worries about the long-term effects of medication or the side effects, and you address them adequately and you give them space and time to digest. I think that's really, really helpful for actually any patient.
So it's a holistic approach, and our conversation today focused on how to manage a relationship with person with BPD, but it's a team approach. It's the therapist, it's the doctor, and it's the caregiver as well. Sometimes the caregiver gets fatigued and burnout, and the caregiver needs to have conversations with the therapist and the doctor as well. So we have to be in this together.
Yep.
Actually, I really enjoyed the metaphors about cars, about the bicycles, all the structures that are necessary for it to work.
I got more about food also, can.
Hey, we were talking about why you're not a Tesla fan.
If you like, I think the audience relate to a lot of real life examples. How not just the structure is there, but also who is the one driving the car, who is the one riding the bicycle.
Yeah.
How do we get about for that vehicle to work as well?
And my hairdresser analogy is that seeing a therapist or a doctor is like getting a good haircut. It doesn't matter whether you pay like a lot of money with the Orchard Road therapist or you go to the HDB auntie, as long as you get a good haircut. So you have to connect with your therapist, and there's no one size fits all. There are people who work well with us, and there are people who work well with different styles. So my advice is, sometimes if you see a therapist or a doctor and you walk away and you say, that didn't quite work out, don't give up hope. You have to audition a few doctors and therapists before you find one that suits. So don't anyhow give 1-star review.
Absolutely.
Maybe you want to edit that out.
So I always akin like searching for a psychiatrist or psychologist to be a bit like speed dating.
Yes, it is. You're right. Yeah,
right?
Yeah,
so you have a really short time to try to get to to discern if you feel comfortable and you're able to trust this person, and if you want to have an ongoing relationship. Sometimes during dating you might decide, I'm done and I'm gonna go. And then you might date somebody else, and actually, interestingly, sometimes you might find that there's a theme of your departure from all your partners / psychiatrists / psychologists, and then within that might be a conflict that may not be resolvable, and that might be something you might want to work with your psychologist on.
Well said, Annabelle. I totally agree with that. There's a theme to it, yes, and a good therapist helps you clarify and understand why your dates don't work out. I mean, dates as in those relationships with your therapist.
Yeah. Coming back to your hairdresser analogy, right? Even my toddler insists on sticking to his hairdresser. Oh my gosh. And I was like, it's a bit far. Can we just cut hair here? It's like, no, mommy. This hairdresser knows what I like. Yeah, toddler.
Can't explain it, but you just feel it.
Yeah, so sometimes it's just the fit, the comfort, the familiarity, the trust actually. The trust is actually probably one of the key components.
I think the first don't is don't be too quick to try and give advice and say, do this, do that, stop crying, get a grip of yourself, get a grip on yourself.
I had it harder.
Oh, I had it, yeah. Just harden yourself and toughen yourself up, so it doesn't work that way. Sometimes parents tend to do that. Yeah. So that's wrong, I think the advice I would give is you got to try and de-escalate the situation. So when the person is in a crisis, nothing you say is gonna calm that person down. So you have to just firstly ensure safety, right? Make sure that the windows, the knives, everything, those are out of the way. Ensure safety, okay, and then you have to wait for the person to calm down. I mean, the truth is, yes, sometimes it gets out of hand, and then you have no choice. For safety, you have to call law enforcement or an ambulance team. That's a last resort. But generally, you want to work on de-escalation and not provoking the person further. Those are my initial thoughts. Annabelle?
Adrian, something has been quite interesting in my clinic recently. So for a while, I've been seeing the one where parents say, you have to harden up. This is not so hard. I had a harder life. This is nothing. But then now I'm also seeing a bit of a shift where parents or caregivers give in completely, and what they might erroneously term it to be gentle parenting, where they just give in and just okay, whatever you want, I give to you. That is also not very helpful.
True. So the two extremes.
No boundaries.
Yeah, the two extremes are to be avoided, and no boundaries. Yeah, that's also wrong. So I tell people that when you're in a state of crisis, when you're dealing with a person in crisis, first of all, check yourself first, okay? If I'm in a bad mood, if I'm tired, just like when you're having an argument with your spouse or your child, if you're in a bad mood, hey, don't make it worse, okay? don't criticize. So sometimes both parties may have to walk away and step away. Like I said, the basic tenet, the most important thing is ensuring safety. Okay, but then sometimes you have to walk away. Sometimes the crisis that you feel is critical at that moment is not so important 24 hours later. You don't even have to wait 24 hours. 2 hours later is not that critical.
So I like what you say, like sometimes you really need to give it some space and don't react immediately. I also often share with caregivers, like when you walk away, be clear about it. Like, I'm walking away now because I need to calm down, but I will be back in an hour's time. I will be here because the walking away might trigger the sense of feeling abandoned.
Yes, that's excellent advice. I agree with you, Annabelle. But in managing a relationship, either as a caregiver or a partner of someone with borderline personality disorder, the main problem is that it's really tiring. So you yourself will get anxious and depressed. So you've got to be able to take care of yourself. The tiresomeness comes from that repeated cycle of fear of abandonment, needing to reassure. So like what Annabelle said, you have to be consistent. You have to have these difficult conversations before the crisis occurs, and help the person grow and mature, One takeaway is that the person with borderline personality disorder may, like what we said, what we were talking before we started the recording, is that the person is not being intentionally manipulative. They are suffering, they're in pain too, you see. And they don't understand why we don't understand that they're in pain. So we provide understanding, but we also have to straddle that line between just being too accommodating, but we also want to educate and show that, hey, this doesn't mean that I'm leaving you or abandoning you.
Yeah.
So it's tiring, but it takes time.